All right, for the third video of the National Asthma Education and Prevention Program, we're looking at classifying asthma severity and initiating therapy. So we're going to focus on the impairment and the risk, with the impairment including symptoms, SABA use, interference with normal activity, and lung function. And then risk is going to be the exacerbations that require systemic corticosteroids. So first off, we have symptoms. For intermittent, this is going to be less than 2 days a week, and that's every age group. For persistent, it's going to be a little bit more separate. So mild is going to be less than 2 days a week, but not daily for every age. Moderate will be daily for every age, and then severe will be throughout the day for every age. And then my computer's moving slow. SABA use for intermittent, it's going to be less than 2 days a week, and that's every age group. And then persistent, we have mild, which is going to be more than 2 days a week, but not daily for ages 0 to 4, more than 2 days a week, but not more than once a day for ages 5 and up. Then moderate is going to be daily for every age, and severe will be several times a day for every age. The interference with normal activity, intermittent, there's no interference, and that's for every age. For persistent, mild includes minor limitation every age, moderate, some limitation for every age, and then severe is extremely limited for every age. And then next up, we have lung function. So intermittent, it's not applicable for ages 0 to 4. For ages 5 to 11, it's going to be a normal FEV1 between exacerbations, with the FEV1 being greater than 80% and the FEV1% being greater than 85%. And then ages 12 and up, it's again a normal FEV1 between exacerbations, with the FEV1 being greater than 80%, and then the FEV1% being normal. And so then for persistent asthma, mild, not applicable for ages 0 to 4. None of these measurements are going to be applicable for ages 0 to 4 because it's just too hard to get them to do the spirometry. FEV1 is going to be greater than 80%, and FEV1% is greater than 80% for ages 5 to 11. And then ages 12 and up, your FEV1 is greater than 80%, and your FEV1% is normal. So then moderate, again, not applicable for 0 to 4. For ages 5 to 11, your FEV1 is going to be between 60 and 80%, and your FEV1% is going to be between 75 and 80%. And then for ages 12 and up, your FEV1 will again be between 60 and 80%, and your FEV1% will be reduced to 5%. So then severe, it's not applicable for ages 0 to 4. For ages 5 to 11, the FEV1 is going to be less than 60%, and the FEV1% is going to be less than 75%. And then ages 12 and up, your FEV1 is less than 60%, and your FEV1% is reduced greater than 5%. And then exacerbations requiring corticosteroids. So for intermittent asthma, 0 to 1 exacerbations a year for every age indicates they might need corticosteroids. And then for persistent asthma, if it's mild, greater than 2 times in 6 months, wheezing greater than 4 times a year, which lasts longer than a day, and then risk factors for persistent asthma, that's going to be in ages 0 to 4. And then ages 5 and up, greater than 2 times a year, which would usually be more frequent and intense events, would indicate greater severity. For moderate, greater than 2 times a year, again, usually more frequent and intense events are going to indicate a greater severity, and that's every age. And then severe, also greater than 2 times a year, usually the more frequent and intense events will indicate a greater severity for every age. And that's all I have for this video.